Dimple, can you hear me?
Yes, sir, I can. Can you?
Okay.
Okay,
Yes.
so we can start, sir.
Okay. Welcome today to our seventh session. We're going to be discussing on injury prevention and, of course, its treatment for squash. And with us, we have Dimple today, who's going to take us through these sessions. Dimple, take over.
All right. Hello, everyone. Sir, am I audible? Hello. Okay,
Yes.
fine. First of all, wish you all a happy Athletics Day today. Yeah. And because you are the people who dedicate your life to build up athletes. Um, so happy Athletics Day. And with this, I would like to start my presentation on injury prevention for squash. So first of all, we have, do you think injury prevention is possible? So always any kind of sports, whether it is an elite level of sport or a recreational level of sport, it always comes with an injury. So is it actually possible to prevent injury? Yes, the injury prevention is actually possible. Am I audible, guys?
Yes, you are.
Okay, 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 fine. So I would want to show you these researchers. I want to show you these evidence to tell you how is it really possible to prevent injuries. So what happened in Norway, where handball is very famous, they started seeing a lot of ACL injuries in female athletes, junior level female athletes. The injuries were so intense that by the time the junior athletes reached the senior level, most of the team players have already underwent the ACL reconstruction surgery. So the situation was very worse at that time. So that's when the researchers came up with this program which you see on the screen. This is a program for handball players and the soccer player to prevent ACL tear. This research is a 13 years long research and proved to be very effective. This brought down a lot amount of skill injuries, not only in handball, also in football. So just like this injury prevention program, there's one more program. So this is a program which was again done by the Norway scientists, research people, in order to prevent overuse injury in shoulder in handball player. So these are the evidence which gives you a proof that injury prevention is actually possible if you really structure a program and if you really uh, look forward towards certain protocols in a very dedicated way. So I'm going to discuss about the protocols which is very important in order to prevent injury. So before that, let's see what are the common injuries in squash. Ankle sprain is one of the most common injury which we can see in squash, and all level of player undergo this kind of injury. Not I see almost in every tournaments happens in Chennai a lot more of ankle sprain. Ankle sprain basically uh, pair of these ligament which you see in this diagram, and this happens when you accidentally place your body weight on the outer aspect of feet. It's a very painful condition, and uh, an athlete recovers in a span of 1 to 2 months after a very good rehab. But the worst part in this ankle injury is Once it happens, there are high chances of reoccurrence of this injury if an athlete doesn't undergo a proper rehab. So ankle injury, ankle sprains are something which is very common in squash. Shin pain. As I told you yesterday, that is high intensity intermittent game. It is an it is a game which has a lot amount of sprinting in a very short distance. So every time you stop, your shin muscle, which starts from here, from your front of your shin bone, muscle have to work a lot in to prevent your body from falling forward. So that's why the squash player, most of the squash player have a lot of shin pain injuries, a lot of injuries which is related to shin muscle and pain behind the ankle, and also sometimes pain in front of the ankle, because we do a lot of lunges. When someone does a deep lunges, what happens? This bone, which is named as tibia, this bone, the front part of this bone goes and hits this talus bone, and up, then the player complains of pain in the in the front aspect of the feet. Similarly, when someone does a long lunge, then the the back part of this tibia bone goes and hits the talus bone, causing a pain in the back of the feet. So apart from this, there are a lot amount of groin pain which is very common in squash because of the lunges, increase amount of lunges we do. And as I said yesterday also, back muscle is something which works continuously throughout a game, because just because you have to bend down and pick up the balls. So back muscles are something which goes for a strain in squash very commonly. So these were joint related strains and pain. Muscle are not left. So what you see in this diagram over here is Rami's um, thigh. So you all know that he suffered a very bad hamstring. Pyramid. And load monitoring is something which is done only by the athletes, but by every person who is related to athlete. We call them as a high performance staff. So who are these high performance staff? So here you see an athlete. He always should have an access to a doctor, a sports doctor, a physio, a trainer, obviously a coach, and a sports psychologist, sport, sports nutritionist, and academics. With the academics, I wanted to refer the research papers. Okay, so so load monitoring is actually all of the you see in the screen right now. Not exactly to do load monitoring. The load monitoring is actually just monitor amount of load an athlete is actually having when he trains, when he goes for the tournament, also when he doesn't train. Okay, we monitor it. So there are two modes of load monitoring. One is external load monitoring and the internal load monitoring. External load monitoring are basic time. You make a note of time, how long a player undergoes the training, how frequent a player undergoes same kind of training in a week. And movement repetition is how many shots you can say how many shots and how many types of front court movements or how many back court movements does he undergoes in a training, and what are the training mode, whether it is an aerobic kind of training or anaerobic kind of training. And if you actually, and if a fitness trainer is actually making him run on court or making him do short sprints on the ground, he makes a note of distance and the speed at which the um, player is running. So these are the external monitoring. And internal monitoring is basically monitoring the heart rate, blood lactate, and oxygen consumption is basically done with equipments, external equipment. We need a lot of apparatus for that. So let's leave that. But it should be done by a medical team. And RPE, rate of perceived exertion. It's a very simple thing, and I feel like every coach should do this. This is nothing but just asking your player after the training that how they feel. This is something which is very important. This is the important part of the load monitoring which you can do with your players. So suppose I tell you how. Suppose if you are making a person play one tough game, and after tough game you ask him to do runs, for example 1 minute on and 1 minute off, 10 to 15 sets. You ask your player to do this in a day, let's say on a Friday, and you ask him how does he feel. So he says like he feels fine. At the end of the session, at the end of the running, he was so exhausted, and he pushed himself to finish that off. So this was his feedback. And suppose if you give the same kind of training next week on next Friday, and you ask your athlete how does he feel, and he gives you a feedback that he was able to do the runs only till fifth set, and after that he was finding it so difficult to catch up with his breath. Then you have to correlate what happened. Like his exertion perception was good last week, and it should have improved this week. Why didn't this happen? Where was the lag? Did he overtrain, or whether he did not take a proper food intake? So these are the things a coach can think, and you can ask help of other staffs who works with you to think where where and what went wrong. So this is how exactly load monitoring has to be done. So what is important in that? You ask your athlete to make a note of every single session. That is how it should be done. Documentation. Documentation should be done not only by player but also by coach. So this helps us in catching up the injury way before it worsens up. So this cannot be done only by an athlete and a coach. It's a team effort. So this teamwork is done by a trainer and the medical staff, physio, nutritionist, everyone comes here who gives you an objective data. Objective data means a data which is measurable. For example, his calf strength is good. He can do 20 single calf heel raises without any problem. So that is a data, a measurable data. So these scientific people gives you a measurable data regarding anything. Like they can tell you that the aerobic strength of the player is very good. Anaerobic strength of the player is something which is lacking behind, and they give you proof for this by an objective data. You take the data with your experience and with your intuition, you manage the load. on the athlete. And that's why I call it as a team management. It's a teamwork to manage a load on your athlete. Hope I have cleared load monitoring for you. The next level in the pyramid is athletic development. So, how how to prevent injury in athletes is by making their body stronger, and by doing by ensuring that they have an adequate amount of nutrition which is required. So strength and conditioning should be on all the aspect. It should be power training, it should be anaerobic, and it should be aerobic. You should make sure that your athletes do the development in terms of strength training by doing all kinds of uh, activity like aerobic, anaerobic, and power training. So this is a way to prevent injury. The next in the pyramid is movement efficiency. There is a debate that movement efficiency should come before an athletic development, but this is how the pyramid is. So, what is movement efficiency? Suppose you have an adequate amount of strength in your back, adequate amount of strength in your hamstring, in your thigh muscle, in your quads, everywhere. But suppose if the mobility is not there, what's the use? So, if the mobility in the hip joint is not fulfilled, if the hip joint is not mobile enough, then your back bones work extra, your knee works extra, your ankle works extra to compensate that mobility in your hip joint. So movement efficiency is very important. You can prevent injuries in athlete by making their joints mobile. So this is something which should be done every day. How? Ask your athlete to do it in their warm up. Mobility is something which they should do, and for every joint, they should do it for every joint, especially for the lower joints, your ankle, your knee, your hip, which is very important, and should be done every day as a warm up. Going to next, a structured injury prevention program. So this is exactly what I showed in the slide uh, as before. So this is a structured program. If you can just see, there are three parts in this program. There is a running exercise for 8 minutes, strength plyometric balance for 10 minutes, and again running exercise for 2 minutes. So this is exactly a 20 minutes warm up structured for a football. So we don't have this research alone took 10 years to to be proved to be approved. So we don't have any structured program for squash in particular, but we can use this evidence in our games. For example, this exercise which you see, this is called Nordic hamstring. Um, this exercise can prevent the injuries which is very common in squash, the hamstring injury which is very common in squash. So this is one of the exercise which we can use to prevent. Okay, so these there are programs for ankle sprain prevention also, which we can also use. So now on top of the pyramid is injury assessment and rehab, which is mainly if at all somebody goes for an injury, you should ensure that the injury is properly assessed by a medical staff and player undergoes a proper rehab so that we can prevent reoccurrence of those injury. And the last part of the pyramid is luck. Sometimes it's not possible to prevent certain kind of injury, so that is also there. So, this is something which I would like to talk about, which is not mentioned in this pyramid: recovery. This is also an important aspect to prevent injury. Recovery. Now we have to see. So your recovery, you generally do stretches, 10 minutes jog, you go for a manual massage, an ice bath. I would like to throw some light on what kind of recovery you can undergo after doing what. For example, if you had um, if you had done a long running sessions, if suppose you have done a ghosting for 3 minutes on, 1 minute off, or something, or a training which was actually prolonged and which didn't had enough rest in between, so you would have used your aerobic system. In that case, you should ask your player to do stretches after the session. Suppose your training had something which was very intense for a very short duration, short, and your training had something which had short sprints with a rest periods in between. That means the player's body had time to recover and restart again every single time. So he did an anaerobic kind of exercise, and you should give 10 minutes of jog as his cool down rather than stretches. That will help a lot. That will prevent soreness of the muscle. Okay, and manual massage is something which has proved to be very effective and which could be done after long long sessions, aerobic kind of session. And suppose if someone is in a tournament, ice bath is something which helps a lot. But again, ice bath is something which you cannot have it only during the tournament all of a sudden. You have to get accommodate to ice bath. All right. So recovery is something which prevents injury in all kind of sports. Right. So I think I've covered the pyramid. You know. So what is very important is the load monitoring, which is done by everyone. Load monitoring is keep a note of every single stuff a person is doing, and also to ask the person if how does he feel after the training. Then the important aspect is athletic development. You um, the athletes should undergo a proper strengthening and should have proper nutrition to develop themselves and to prevent injury. Movement efficiency, that means they should be very mobile, their joints should be loose and free to do the movement. Otherwise, there is no use of all those strength training they did. It's important to be mobile in order to prevent injury. Then a structured injury prevention program. There are few programs which is helpful in preventing, as I showed the hamstring one. And if at all they have undergone any injury, their treatment is very important in order to prevent reoccurrence of same kind of injury. Apart from this, the additional point to prevent injury, sir, never overdo anything. Always listen to your body. Pushing is something. So that's where the coaches play a very important role. Sometimes players out of adrenaline rush, they say like, no, I have to push, I can do this. But you have to uh, have a picture of your athlete in your mind. You should know that I know this is the limit. This is how much he can push, and I should ask him to stop. So never overdo anything. Always listen to your body. Wearing protective gears, yeah, of course, that will prevent injury. Proper shoes is also set is proved to prevent injury. And of course, personal hygiene, especially here onwards, when we are under this grave situation of pandemic, personal hygiene is something which will prevent, which will also ensure a very good health, not only for the athletes but for all the coaches and all other staff working with the athlete. All right, thank you. Over to Cyrus sir.
Thanks, Dimple. Let's open up to questions. Dimple, if you want to speak on anything else or ask some questions.
Okay, one second, sir.
As of now, no one's yet put anything in the chat box, so feel free to write in, coaches. Okay, I straight away see one coming in. Dimple, can you see the chats as
Yeah.
well?
Yeah, I can see this chat.
Okay.
Okay. Duration of warm up before the match. Okay. It is proved that 15 to 20 minutes of warm up is good, and your warm up should be a lot of mobility stuff, not static holding stretches. It should be more dynamic and very much uh, s- um, it should mimic your sport. For example, our sport is lot of amount of short sprint and lunges. So warm up should be something which have lot amount of small distance running and changing the direction and lunges. So 15 to 20 minutes of warm up is proved to be um, good enough to prevent injuries. Okay, see something. All right. What is what are the causes and cure for tennis and golfer's elbow? Um, Causes, there are a lot amount of actually tennis and golfer's elbow is inflammation of your two sides of your elbow. So you have inner side and you have outer side. Uh, if you have pain in the inner side of the elbow, you call it as golfer's elbow, and if you have pain in the outer side of the elbow, it is called tennis elbow. There are a lot. There are many causes, um, like overuse of the wrist muscle. This could be because of poor technique, or sometimes if you see in female, the angle of we call it as carrying angle. Sometimes the angle is uh, larger. Then there are chances they can have tennis elbow and golfer's elbow. And cure, take them to the proper medical doctor. They will do it. I think it's a big topic. I don't think I would be able to explain it, the cure and all over here. The If you find someone with tennis elbow and golfer's elbow, if you find someone with pain in the inner and the outer aspect of the elbow, make sure that you give the person adequate rest and take them to the medical practitioner. It could be an orthopedic doctor or an orthophysio or a sports physio. They will do their job. Okay. Please tell some hamstring strengthening exercise during rehab. Okay. Okay, I will send the hamstring strengthening exercise during. But see, the thing is, not all the injuries happening in hamstring are similar. Everything is different. There could be injury in any part of hamstring. Hamstring is a long muscle. It can happen near the butt region. It can happen near the knee region. It can happen in between, as you saw what happened for ramming. For every kind of injury, the the strengthening exercise differs. So so I think, like, it purely depends on what kind of injury you have, which determines the rehab exercise. Okay. So how many times a week a player can take ice bath, and ice bath is good for old injuries. Okay. Can you tell me what do you mean by old injuries, and how
I would
many times
I would guess it's a recurring injury or something which is existing.
or recurrent in, like which happens again and again?
Yes, or something which is already existing. You can answer for
Okay.
both. It's a difference.
Okay. So how many times a week a player can take? See, if you have really done an intense kind of training, you can have it twice a week, but generally recommended is once a week. There are people who take uh, ice bath almost alternative days after very strenuous power and strength training. So it depends from player to player. There is no fixed protocol that on, like just like how you take a paracetamol tablet. We don't have that. Like it differs. There are elite players who do it every alternative day, and there are players who do it every day, and there are players who just do it just before the tournament. So it purely depends how your body respond to it. And ice bath is good for old injury. See, what ice bath does is it um, relaxes your muscle. That's the main thing. It relaxes your muscle. But and by relaxing your muscle, it increases the blood supply, and also it soothes the muscle in such a way that person doesn't feel pain for a period of time. Okay, so ice bath cannot be taken or considered as a treatment for old injuries. It's not a treatment. So for injuries, you have to undergo the proper treatment, and for recovery, you can have ice bath once in a week to start with. How to once again, how to prevent hamstring pain while doing lunges exercise? Does it mean glutes are not working or that hamstrings are weak? How to prevent a hamstring pain while doing lunges? Okay, so when you do lunges, you start feeling hamstring pain. Okay, fine. So it could mean that your hamstring is strained. So when you do lunges, your hamstring works. So if someone feels pain while making that muscle work during that time, like if he feels pain while making the muscle work, that means the muscle is strained. Okay, so you have to take treatment for the strain of the muscle. Does it mean that glutes are working or not working? You see, this cannot tell. Like having pain in hamstring during lunges does not say that your glutes or your hamstring are weak or not. You have to check it separately. You have to see if your glutes are not working, if it is weak. So this is mostly done by a physio practitioner or by a medical doctor. They will tell you. You have to check it. The This hamstring pain while lunges cannot be considered as a clue for glutes weakness or hamstring weakness. Pain in a hamstring while lunges purely means that hamstring is strained. The injury in the hamstring has happened, and that has not gone. It's still there. Like we have not worked on it. That's exactly what it means. How could you highlight symptoms of Hi, could you highlight symptoms of sprains and strains? Okay, so sprain is something which happens in your ligament, and strain is something which happens in your muscle. Symptoms of sprain and strain. See, these things are, there has to be an history of injury behind strain and sprain. So, suppose they say they have sprained the ankle ligament, there has to be a history that they have landed on the outer side of the ankle and they have twisted the ankle. So, that's the main indication. And the second indication is pain. So history of injury and the pain is, it's the pure science. I won't say symptom. Symptom is a scientific word which symptoms mean something which your doctor or your medical practitioner finds in your body. So I would say science. The main science of sprain and strain is pain and the history of injury. This is something which you should know. Main exercises to be included before every match and after match. So before match, as I said, it should mimic your game. It should mimic your game. So mobility is something which is very important. So you will always start. So I will tell you. So you should always start with balancing exercise. Balancing exercise, single leg standing, eyes open and eyes closed. You always start with balancing exercises. Then you go with the mobility kind of exercises, and after mobility exercises, after doing a good mobilization of all your joints, then you go for a short run, short sprints and lunges, quick lunges, something which mimics your game. So those are the exercises which you should be doing before match. And after match, yeah, after match is, you always start with 10 minutes jog, because match you would have definitely used a lot amount of anaerobic system, and there will be a lot amount of lactic acid present in your thighs. So after match, make sure that you do 10 minutes of jog, and after 10 minutes jog, you can continue to do your stretches. This is something which you should do post match. And obviously food is very important. Okay, how often should an athlete take an ice bath? So as Harry, um, so it purely depends on the person where he lives. The research says that once in a week is good, but it also depends on the amount of activity. If you have really not done anything, if you have not worked so hard, there is no need to take an ice bath. If you have really worked hard and if your muscles really need that relaxation, even alternative days will not do any harm. Ice bath is not contraindicated. It will not let you it like everybody thinks that if you go for an ice bath they will catch cold and all, but it's not true. The cold which you get is not from the ice bath, it's mainly from the viruses and bacteria around the environment. And it could be something which is present in your body, and if your when your temperature goes down, it comes out. Okay, so ice bath, if you have really did a hard workout, even alternative days is fine.
Dimple, on the ice bath, if I could just ask, because a lot of people may want to know also, is what is the duration of the ice bath? How much time should we spend in? What are the short? What is short? What is long? And how often should we do it in that same session?
Okay, so there is a contrast bath. So there are two types: the continuous ice bath and the contrast bath. So if you do, there are people who do continuous ice bath, especially the Europeans. They do like 3 to 4 minutes of continuous ice bath, and they just do it once and come out and go for a shower. So there is one more thing called contrast bath. So which I would recommend, which I tell players to do it, which is 1 minute inside the ice and 1 minute outside, which could be under the shower or inside a pool. So you do contrast in and out, one in and one out. 5 sets of this has proved to be very effective. Your view of on teenage players wearing ankle guards and training playing tournaments. they get into a habit of playing them on a regular basis. Yeah, they should never like the outside supports. We should never encourage these kind of supports from outside, especially the ankle guards or knee guard. Um, yeah, the ankle guards and knee guards while playing or even while training. Um, and what see, your body has, your joint has nerve receptors, so they send the impulses from the joint to your head, telling in what position your ankle is, in what position your knee is. So what happens when someone wears these kinds of guards like ankle guard or knee guard? This impulse, like the brain doesn't get these kind of impulses because those muscles, those nerves doesn't work only because they don't have to work. You have given something, you are not letting them work. You have given an external support, so this muscle and the nerves which has to work to support your joints doesn't work, and the brain doesn't get any kind of impulses that time, and over a period of time brain completely forgets about it. So that's why they get into habit of uh, playing with them in a regular basis. So this is not good. This properly shows that they have not done their rehab on weaning from it. For example, so when you get an ankle sprain, you go to a physio, you do strengthening exercises, you do all the balancing exercises with the guard, and slowly you should come out of the guard and you should be able to do those exercises without guard. You should be considered to get on court only when you are able to do jumps without guard. So that should be the level of rehab. If a teenager is playing with the ankle guard, then after an ankle sprain, that means the rehab on weaning off is not done properly. So this habit is not good. But there are exceptional cases also. But mainly they should not. What are the best exercise for knee and elbow injury? As I said, it depends on the injury. Exercise cannot be same for all kind of injury. It depends. There are different kinds of elbow injury. There are different kinds of knee injury, and your exercise not just vary with the type of injury. It also varies how you got the injury. Is it a trauma or is it an overuse? Overuse has a different set of exercises and trauma has a different set of exercises. So I think, like, if you really want to know best knee and elbow injury exercises, it's always better to go meet a physio or meet a orthopedic doctor, especially meet a sports physio, get it assessed properly and get a proper protocol. Reason for shin pain, as I said, the there are many reasons. One of the reason why we squash player get shin pain because the nature of our sport, we do short sprints and we stop with a jerk every single time when we want to hit a ball. So whenever we stop with a jerk, your muscle, especially in the front of shin, works very hard to stop your body from falling forward. That's the exactly reason why that muscle goes, your front of shin muscle goes for strain. It actually works a lot. So that is one reason for shin pain. Apart from that, other reasons are, suppose your foot type. Few people have flat feet, few people have high arched feet. So shin pain could be because of type of foot you are having. It could be because of shoes which you are wearing, but mostly it is because of the amount of running you do on court. So if there is a shin pain, the shin muscle has to be strengthened, not only by strengthening exercise but also by making them do very graded running. For example, If a person is complaining of shin pain, this has to be done in a very scientific manner, but I'll tell you what it is. Suppose if a person complains of shin pain after 1 minute of running, so what you do, you give him strengthening exercise. So we normally give strengthening exercise for the shin muscle and make him run, and we find that he's able to run 1 minute plus extra 10 seconds. So we stop him there. So next day onwards, for a week, we ask him to run only for those 70 seconds. Then for next week, we'll increase the duration. So when you slowly increase the duration of run, you are actually training, re-educating your muscle to accommodate to the speed. So this is a scientific way of dealing with shin pain. But as I said, any kind of pain and injury, the exercises and the protocol varies from person to person. It varies how they got the injury, and it varies why they got the injury. Rehab exercise for ball and socket joint injury, as yeah, you have to tell me what kind of ball and socket injury. There are two ball and socket joint in your body. One is shoulder and one is hip. So which injury is that? How you got the injury? So it's a medical session. I cannot say rehab exercises for injuries right now. Which is most common injury you have seen in top player? Any precautions for the same? Common injuries. Hamstring is one injury which I have seen commonly. Hamstring, ankle sprain, and the ankle impingement. If you remember, I showed you that slide how the bone hits each other, producing the pain. Those are the impingement is something which I have seen very commonly, and precaution for the same. The precaution is mobility. For hamstring, a very good strength, and especially the Nordic exercises which I showed, that will help in preventing. If you want to prevent ankle injuries, I have not seen ankle injuries in top players, but only in small players, because most of the top players, they do their balancing and single leg standing exercises very religiously. So I have not seen them suffering with ankle pain a lot. What I see a lot is common strains in muscle, and that is purely because sometimes the demand of those muscle is high in a match. That's how it is. And precaution is always strengthening a very good mobility. Mobility is a key. I felt that mobility should be something which should come before strengthening. Mobility is the way to prevent injury. Cause of shin splint. How does one prevent or strengthen the shin? I will send you the exercises to strengthen the shin pain. Exercises to strengthen the shin muscle. Strengthening for shin muscle. Do we use cold pack? When do we use cold pack and when do we use hot pack? When you get injury, immediately after any kind of injury, it could be like on court injury, it should be always cold pack. Hot, I don't actually recommend hot pack much. uh, Always cold pack. The reason behind is it reduces the inflammation. See, when your ankle goes for an injury, that means there is a break. The ligament fiber goes for a tear, and when the ligament goes for a tear, your body mechanism is to do the healing process. And when it does the healing process, there is lot amount of chemical reactions happening. If those thing happens in the ankle joint, the ankle swells up a lot. And if the ankle swells up a lot, it really takes longer duration to come back to normal. Okay, so cold pack is something which reduces all these things. It doesn't allow a lot amount of blood rushing to the injury site. So that's the main reason why I would recommend cold pack always after any kind of acute injury. The moment the injury has happened, bring the player out of the court, make him sit in a very relaxed position, and apply ice. Ice is the foremost thing which one should be doing as soon as they have injury. How much jogging time should include before every match out of 15 to 20 minutes of warm up time? Okay. Uh, I actually don't know the exact answer, but what I have seen um, from the structured programs of other games, it varies from game to game. So few say 2 minutes of jogging, few said like 5 minutes of jogging. What you saw in this FIFA 11 warm up program, it had 8 minutes of jogging. Uh, I feel like there is no evidence. I don't have any evidence or proof to tell you. So this is the timing you should be doing. This is the timing you should be doing. I think Harry can tell us how much does he do. Harry, can you help me out here? How much of jogging time do you do when you do warm up? Because I don't have a proof to evidently say this is how much you should be doing.
Uh, Ma'am, I don't have exact time, but I do until I sweat a little bit and I start
Mm.
feeling very relaxed from head to toe. And
Okay.
so it can be like max can be 10, but generally
Huh.
I keep jogging, I stretch, then I jog again. Then I stretch certain parts of my body, for example, a lot of lower body, and then I jog again to see if the jogging has helped me to increase my flexibility while while warming up. And so like on that basis I do.
Uh, yeah. Yeah, thank you, Harry.
Yes.
See, that's actually a very valid point. Like as long as you sweat, like when you feel like the main reason why you jog is to increase your temperature. So once you increase your temperature, you start feeling warm and you start sweating, and that is the limit till what you jog. And then you should be giving more priority for mobility, and especially if someone is stiff. If someone is flexible, then it's fine, but if someone is really stiff, I have actually seen a lot of young players. They are not very flexible in their hip joint, because of the lifestyle we have accommodated now. We don't sit on the floor anymore. We don't eat sitting on the floor in a palti position anymore. So all these kind of lifestyle has really made your hip joint stiff. So the mobility is something which you should be spending more time on. Jogging time should be as long as you warm up, you sweat. So once you sweat, you should be spending time on other activities like balancing, um, and mobility, and short sprints and lunges. Okay. What are the best exercises for knee? There are so many exercises for knee. Um, yeah, and all of them are good. So I think you have a session. You have a strength and conditioning session also in this program. Uh, is it not, Cyrus, sir? They have a strength and conditioning session also, right?
Yes, they do.
Yeah, so I think they you will get to know about best exercises for your different joint in those sessions. Very good. Nordic hamstring is not easy for children. They may have more injury, which could be what could be the other exercise. There are modifications for hamstring, Nordic hamstring, and you can actually do those modified way to teach a child. But yeah, as you said, it's not easy for children, but it's not that they won't be able to do. You have to be there and teach them a correct technique. If they actually learn the technique, they would be able to do. There are modified ways of doing Nordic hamstring, like um, I will send a Nordic hamstring modified exercises to Cyrus, sir. I will do that for sure because that's very important. I will send it. How necessary it is to use a roller exercise before and after training? Okay, fine. Regarding this, see, this is what researchers say. It uh, rolling on the foam roller actually doesn't makes any difference. So this is exactly what research say. But but it really mentally it really makes a difference. I have really seen people player telling that they do feel relaxed after doing foam rolling. But research wise, there is no proof that it really loosens up your muscle. Um, yeah, that's the main reason why people roll. But I feel like it really improves your blood supply and it helps to mobilize the muscle tissue. That's exactly what rolling does. Like it is just like a manual massage. So after post training, I would always recommend rolling, though though it is not proved by research or evidence. I would personally um, tell players to do rolling, especially because it is very similar to a manual massage. What gadget or equipment should be carried by every sportsman, especially squash player, for repairing of muscle and avoiding injuries? No, there is no gadget or equipment. Yeah, there is no gadget or equipment to for repairing of muscle and avoiding injuries. What exactly? How? See, this is exactly the motive of this slideshow. This motive of this class is to tell you it's these gadgets and equipments will not do anything. See, it's your pre-tournament training. It's your everyday work which will prevent injury. It's not a single gadget or equipment which is going to help you. So it's the strength training which you do every day or alternative day, the mobility exercises, the cool down, the recovery thing which you do every day, the load monitoring, how you meticulously see how you meticulously check how much how much you have loaded, how much you have trained, how often you have done a same kind of ghosting. All this work prevents injury. A gadget or equipment will not actually prevent. I think you meant the uh, equipments for recovery, right? I'm not sure how much the equipment like the Theragun is helpful in preventing the injury. I personally and not only personally, with evidence with research, I can say the general stretching warm down, a very good warm down, a very good stretches is enough to prevent injury. There is no special gadget or equipment for that. What measures and prevention should be taken regarding regular calf pain? What is a cure for the pain that goes on regular basis? Exactly. Okay, so we have to find out what is the reason behind the calf pain. All the calf pains are not similar. It varies from person to person. Unless someone assesses and finds out what is the cause, the treatment cannot be suggested. But how to prevent calf pain is by doing good calf strengthening exercises and by good calf mobility exercises. You have to but that's how you prevent injuries in any kind of muscle. You can prevent injuries in any muscle, be let it be calf, hamstring, or quadriceps. Strengthen it and lengthen it. That's how you would prevent an injury. More than lengthening, strengthening. Strengthening is how you prevent a calf, any kind of muscle injury. When injured, how do you know? How do you know whether to apply hot bath or to apply cold bath? When injured, see, immediately after injury, it's always ice pack. Never, no hot bath. No. Hot bath is for the people who suffer from degenerative disorder, especially like uh, which is not common in athletes. This is degenerative disorder is common in old age people. They are the candidates for hot bath, not an athlete. How helpful is Teitzman and why should it be used in post injury? Mm, okay, fine. So whenever, as I said, like whenever there is an injury, there is an inflammation process happening, there is a rush of blood to that injured spot. So compression and tights are something which will prevent that rushing of blood, that accumulation of blood. It will prevent that swelling, which is going to reduce your healing time. So that's why tights are helpful, and that's why we apply crep bandage immediately after the sprain. If especially the ankle sprain or even wrist sprain, we don't want that swelling to happen over there. So as soon as an ankle goes for a sprain, ice and apply that tight crep bandage to prevent swelling. So tights is actually helpful. Preventive and remedial exercises for plantar fasciitis. Mm. Okay. It's a very big condition. Plantar fasciitis is one small word, but actually the cause for plantar fasciitis is different, and there are so many exercises for that. Please send me a mail. I will send you the exercises for plantar fasciitis. How to treat ball injury, racket injury, and blood injury. Where is it? How to treat ball injury. So these are the external injuries, right? Okay, the ball injury and the racket injury is the external injury, and icing is the only thing which you have to do. Blood injury, uh, of course, bring them out of the court and clean it with um, an antibacterial solution and cover it. That's how a blood injury should be treated. I think these are the things which is being already covered in your level 1 and level 2 coaching things, right? Uh, does custom made insole helps in injury prevention or flat feet? Yeah, custom made insole really helps in injury uh, for injury prevention for flat feet. That's why I said like shoes can prevent injury. Custom made insole is actually helpful. Yes, yes. Suggest exercise to give more strength to knee if the player has a history of MCL injury. Okay. Um, Carry on. Okay, so I have typed my mail ID. If you want like particular exercises, mail me. I will tell you. I will send you the photographs because I don't think it's ideal to just tell you exercises uh, by word of mouth. So do mail me, and I will give you an exercise program with picture. How can we? Okay. Exercise to give, suggest exercises to give more strength to knee. Okay, that's done. How can we prevent?
Dimple, are you there? Have we lost Dimple online?
She's online, sir.
Okay, but
Voice.
two questions to go and she's missing in action. Uh, okay, so I think has lost her network right now. So the two questions I can see, the final two questions really is um, suddenly some more questions have come in, but with regard to the percentage of strength training of quadricep and hamstring, extremely important to work on both. Very, very important. A lot of people only want to work on their quadricep and forget on the hamstring. So, when you would say percentage, I'd need to check on it. But of course, weight wise, you would not be able to train with the same weight. But every time you do your quad session, you should do hamstring
Hello,
sessions.
hello.
Dimple, can you hear me, Dimple? Okay, and finally, back injury plays a huge role in an athlete. Please give us a little bit of back injury and prevention. If Dimple is here, she will tell you, but back strengthening exercises are extremely important, something which we all should do uh, prior to sessions, prior to matches, and afterwards. The more we do, the stronger obviously we will get. So important to do both uh, strengthening exercises for the back. Obviously, a lot of people have a lot of back problems. If it definitely gets serious, you definitely would then need to go and see an ortho in order to solve that. All right, I think that's it for everybody. Thank you all for joining in today, and we look forward to our session tomorrow. We've got our two Indian stalwarts who will be conducting the session. I see nice big smiles on both their faces. Uh, so, for all of those who don't know who's coming up tomorrow, please come and join the action I'm sure we'll have some fun. Thank you all.
Thank you, sir.
Thank you, sir.